Brother Najeeb, you can start.
Assalamu alaikum. This is Dr. Najeeb Ranginwala. Thank you very much for inviting us. This lecture is Fi Sabilillah. Um, I'm trying to. Today's the topic is mental health in Islam. I feel like that is a significant, important topic to be discussed in our community as a whole, and figure out the issues and what are the shortcomings are. So, just like any other diseases in the medical disorder, we have also disease in mental health. And first of all, we need to address that there are diseases in mental health. So we have diseases and traits. Traits can be something which are in early stages of development and not full blown into a disease form, like personality traits. Sometimes you have behavior traits. So these are there, which psychiatrists or psychologists look at it and figure out, is it full blown disease or it's in a trait form? So, and then try to figure out how can we help them, the best we can. So, coming back to this issue of disease, so first, what I feel like in our community, we need to address this issue that there is a mental health disorder. Let me go into briefly, mental health disorder or number of mental health disorder at different ages. So I can go briefly from the age of geriatrics or old age to childhood age. We have mental health disorder, which is commonly seen. So like in old age, but now it has changed, the dementia complex, or what we call the neurocognitive disorder. Nowadays it's called major neurocognitive disorder, minor cognitive disorder. So in the major neurocognitive disorder, we have Alzheimer's disease, which starts at the age when they present to the family members or outside at the age of 70. Then we have Lewy body dementia, which is 70 or around that age. Vascular dementia, which starts just after stroke, pretty much. And then we have mixed dementia. And there are dementias like disorders are maybe 30 20 to 30 disorder have dementia complex in it. So there are a list of dementia complex. So I don't want to go into detail. But the other dementia, which a lot of people are not aware of it, is frontotemporal dementia. Frontotemporal dementia start at the age of 40. I just want to let you know. So if you have come close to 40, and it can develop. So don't assume dementia starts at old age. It can start at early age. And the Alzheimer's dementia, which starts at the age of 70, actually the process starts at the age of 55, 60. It starts building up at that time. And we present at the age of 70, or usually at that time. So just keep in mind that these processes start much earlier and they present at a later age. Just like when the kidneys start failing and you look at GFR rates and all those things. So when the creatinine goes up, half of the kidney is lost before you have a creatinine level goes up. So same thing will happen with dementia also, that a lot of memory process is completely destroyed and neurodegeneration has taken place before the process when it's present to you. So keep this in mind. But frontotemporal dementia start at the age of 40. So, and then, so this is from the old age. Then you can go to adults, which have anxiety disorder, major depressive disorder. We have schizophrenia, we have OCD, we have PTSD. These are different entities. It used to be part of anxiety disorder, but not anymore in DSM-5. And then we have eating disorder and the addictions, and there's a lot of other disorder, but these are the major ones. So, and then we have in kids, we have attention deficit disorder, which we call ADHD. We have autistic disorder, learning disorder. These are very common over there. I'm just giving you the basic bulk of the psychiatric disorder. What really happened is they all have behavior problems. They all have behavior problems, and that is what the one they present to you. Unfortunately, we disregard those behavior problems until they become so bothersome to the family or to themselves, or whether in school or college, that we seek help. The question is why it was missed. is the first question we have to ask. When it's bothering in our family and all those things, why we don't get help. Like with medical disorder, we go every year to a doctor and see our blood pressure, our lab work is done. Some places they do EKG yearly. It's not recommended by any American association, but they do EKG regularly. And so, we do medical workup, but for psych, we don't get help. I'm not we should not go to psychiatrist every year. That's not my recommendation. But if you have a behavior problem, we should think about it, that is it within the normal range or it's going outside the range? And if it's going outside the range, which is the question asked, does it bother them? Does it bother the person or the family members, and is significantly affecting their life? So that should not be taken lightly. It should be addressed by a psychiatrist or psychologist, that this is going on and how can we get help. And if they are catch at that early age, what we have seen in psychiatry very significantly, that the the prognosis is excellent. It's very good, on the whole. I'm not talking about individual disease, but even to the worst disease like schizophrenia. So in schizophrenia, what we call is disease burden. So the if you what we have seen, that a person who is diagnosed with schizophrenia within 1 year of time and got treated, they have the excellent prognosis. They recover much better than person who has been diagnosed 2 years later, or worse is 3 years, and as 5 years, 8 years, the prognosis get worse. Because what we have seen in psychiatry, that the brain cooks in this disorder, and it's cooked so badly that the neural connections are completely distorted. So now when you provide them treatment, the recovery is not that great. It could be better, but it could be better if you have done earlier. So that should be always kept in mind, that these people who have some mental health issue should be treated, or should be seen by a psychiatrist or psychologist, and get help. So that is significantly important for us. So the question comes in us, and especially I see in our community where I come from, I am involved in it. So the problem with us is the taboo. That is the biggest issue, that we don't want to talk about it. And we don't want to, because of concern that what will happen if my neighbors know, my friend will know that my child has, or my family member has, or somebody has mental health disorder. So they try to avoid as much as possible. So what we are doing is cooking the mental health disease in a person. And then when we get help and does not get better, we blame the psychiatrist or psychologist. Well, you didn't do much. Well, the question comes, when it was initial stages, where were you? You should get help, seek help, and was not provided because we were caring about our ego and our taboo, that how can I get out of it. And the sad part of it is that a lot of physician does not recognize that there is called attention deficit disorder. I see that they don't believe in it, because it will go away. I don't believe in it. And I can see in our kids that there are tons of kids have attention deficit disorder, but they don't seek help. And the prognosis is really good in this way, that if you treat them early, the behavior pattern develop much better. They have much good self-confidence. They can face the world better, rather than low self-esteem, and they get into bullying and all those things that can be easily avoided if you treat them well at early ages. So then they get better. So the taboo of our community is so significant that it avoids that from seeking help. That also goes with our religious people who should be also be aware of it, that there is a mental health, and we should not associate all when somebody does abnormal behavior as as a behavior of shaitan, and then started uh, giving hard time to them, try to know them well, what is happening in their life, rather than put to the stand and then criticize them that you are doing wrong, because they may be going through a mental health disorder, and people with schizophrenia, Allah does not blame you if you are not in good health or mentally not in good health to do the prayers, correct? They can miss it, correct? And Allah has taken away all those thinking, and they can do that. But we, on the other hand, criticize them that you have been taken over by shaitan, and criticize them not realizing they're going through schizophrenia. People with bipolar disorder can have the same thing. People with conduct disorder can have same thing, and all those things. So we should not jump to conclusion rather than get help, because we have a taboo and we don't want to get help, and then we criticize them for their shortcomings. So we should be very be aware of it, just like in medical disease. We should be also aware of in mental health also very well about our kids, and get all the help needed. And that is a huge concern I feel in our society. That is, we who have this issue, and we don't take care of it because it's affect us. So, and how can we get out of it? And that really put our kids in more turmoil, and more in the prognosis goes worse if they have it. And there's always a good chances they will get better with help. And there are a lot of treatments available. You have behavior treatments to help them. Like in major depressive disorder, you have cognitive behavior therapy. You have not even started giving them medication. You just make them think how they can handle the situation. A person with significant depression, they sometimes don't pray, not realizing they are going through a significant depression. So let them help them with the depression component, and then it's between Allah and the person. Rather than we criticize them that you're not praying, it's not we have to criticize them. We can only guide them and help them. And unfortunately, in our community, we criticize them and say, all the bad thing, but we should not do that. We can only help. So that is my point of view, that we should be very cognizant. We should be aware of it. That mental health is a disease, and it can. We are not just like flu. There's no cure for flu. So mental health, there's no cure. But with the treatment, with the behavior therapies, and with all those things, their life is very manageable. They can live a good life, and they can practice what they want to do. And that is what is meant for. That we are not curing them. I don't think so there's any mental disorder that can be cured. So as a lot of medical disease cannot be cured, like hypertension. We don't cure hypertension. There's no cure for flu. There's no cure for Parkinson's disease. There's no cure for so many medical disorders. So don't blame psychiatry that though you don't have a cure. We are helping them to live a productive, good life, and that can be usually can be provided if we are aware of it, rather than blaming them that you have shaitan and shaitan is doing this to you. We should not jump into conclusion rather than know the person well. People would have personality disorder, and that is another factor we should always keep in mind, that they have personality disorder and they will behave that way. So in personality disorder, very simple, which is very important for anybody who is preaching Islam or teaching their kids to know about psychology and psychiatry very well, because way they talk to each other, like when you're teaching any person, you can literally tell their personality by the way of their defense mechanism, like what type of defense mechanism they are using. Defense mechanism, as I mentioned to you in the previous lecture, is how the responses, where the ego respond to the id, and how they use from Sigmund Freud. That's what his thinking is. And we have tons of defense mechanisms. We have mature defense mechanism. We have narcissistic defense mechanism, and that can tell you a person is narcissistic or not. Person, what type of personality disorder they have. Are they antisocial? Are they psychopath or sociopath? And when you know them, you can help them very well because you know their personality and how to deal with them. This is significantly important for people with teaching Islam and all those things, that you should know mental health very well before you preach them, because you're not going to preach anything to a psychopath. But do you know who is a psychopath? No, if you don't know that, how are you going to preach? You go into argument with them and you go nowhere. If you know mental health and how you deal with them, you have a better idea of talking to them and addressing them. And that is very significantly important for our community, especially who teaches the kids, who teaches uh, adults about Islam, to know about mental health uh, and go from there. My presentation is one of the way you can get help without, buying a book. You just go through my presentation, and I went through in detail about different theories in psychiatry and how it applies. So at least you have idea. The other thing which you do is online, go online and learn about it, or know from attending some courses where you can do. So there are different ways you can learn about it, and I will encourage every one of us as a parent to know about behavior science very well, because our kids have a lot of issue going on, and until as we don't know our mental health well, how can we teach them? So that is my point of view, that we should take care of our mental health and approach properly, and that will help our community very well. Does anybody has any question regarding that? Please, you're most welcome to ask me.
I have a question.
Sure.
I dealt, mashallah, this is a very important lecture, by the way, and it needs to be the beginning of a series of lectures, because you mentioned one point, which is the issue that it's a taboo. In the Arab community, mental health issues are hidden. They are pushed under the rug. No, they're not talked about, because in our society, let's say if a family has mental health issues, the girls in the family don't get married, because people think they have maybe an uncle or a brother or something that has mental health problems. Can everyone hear me?
Yes, we can hear you.
Okay. So it's serious consequences for announcing or letting an issue like that known. The second problem I faced and I dealt with personally is not having enough knowledge to be able to recognize a mental health issue. We dealt with a person, and we attributed their behavior to all kinds of things, like, oh, they were not raised well, or oh, they're really corrupt, or they're how our brains work. Everything but asking the question, maybe they have a mental problem. So that person ended up being diagnosed with schizophrenia, but it took years. And by the time they were diagnosed with schizophrenia, they were so far into it that the treatment was very difficult. So what we need, like you said, we need education on how to recognize. So a list of common things. How do you recognize a person that has schizophrenia in the first stages of schizophrenia? When they start becoming paranoid, when someone comes to you and says, I'm being followed, that's a flag. You got to start asking questions. I'm being followed, or things like that. Simple things that they might hint at. And sometimes we even joke about it or laugh or ridicule the person without listening. We need to learn how to listen, and then how to get enough education to be able to recognize. And I think that's first step. Because if we live in denial, and we are ignorant enough to, we cannot, point to the issue, that there is an issue, or develop the habit of going to a psychologist or a psychiatrist, a professional, and asking them, can you tell us if there's an underlying issue here? If you can elaborate on that, I'd appreciate it.
Thank you, Brother Yusri, for calling from Egypt. I really appreciate So you raised a very important question. So how do we recognize a disease? That is very important. Now, the problem comes in. I will tell you what the problem is. Like major depressive disorder, they present what we see commonly, but they present differently at different age group. you know. So so in kids, they present as they present with agitation, aggression, hitting, or verbally abusive. The mood symptom is much lesser than aggressiveness is there. In adult, you have a whole cluster of symptoms, which is could be mood or could be apathy. The apathy is different than mood is, so either one of them should be there, and then cluster of other symptoms. You have sleep, appetite, energy, concentration, anhedonia, worthlessness, suicide, homicidal ideation, and all those things. So there's cluster of symptoms available, but the main symptoms is could be mood or apathy, where you lost uh, means you lost interest in doing things, so that is very important. So and then in geriatrics, the people who are old, the most common presentation is abdominal pain. So but with a feeling of depression, but abdominal pain is the most common. So the symptoms keeps on varying with the age group, so there's not a single one you can say this is one and will hit it. It varies with the age group. So my suggestion, and that now, if you come to schizophrenia, you come to anxiety disorder, it keeps on varying. You have a prototype, and then it keeps on varying. Depends on the age. So my only way I can say, look at the normal values. What you see normal. It's very easy to identify normal. Anything away from normal is a red flag, and if it bothers them or bothers somebody else, most of them, like 60 to 70% of the time, you are right if you say this is normal and this is abnormal, and then you address that issue. But there's another question came up, which last time, that hitting a bird or hitting something or doing things, that is totally abnormal. In any culture, if it says that's wrong, so that gives you a red flag. Or people killing the birds or animals or things like that for pleasure, that's totally abnormal. Yeah. We should not rely on culture values. We should rely on what is the correct value, and go from there. So it's a cluster of all the symptoms put together, but it's easy for us if we know what is normal, and anything outside the normal range then is a concern, but that covers 60 to 70%. Now the 30 and 40% are very difficult, and I will bring you up. Among you and me, there are a lot of sociopath and psychopaths out there. Psychopaths are less, but sociopaths are very common. These are the antisocial personality disorder. These are very common. These are people who are not affected. Their life is not affected in that way, that they are always right, world is wrong. They will do anything wrong, but that's okay with them. And they are productive in life. So there are some groups which are totally different from that range. I'm just giving you a heads up that that's what it is. So usually the answer is, what is normal? Anything outside the normal range and is affecting your family or somebody else should be taken care of. There are cluster of symptoms for schizophrenia: hearing voices, seeing things, abnormal behavior, their voices, their thought process, and all those things. There's tons of symptoms which we talk to the patient and find it, but it will become very obvious that's abnormal. But the behavior changes come much earlier, and if you see some behavior changes which is not in a normal range, that is a red flag that we should see help from a psychologist or psychiatrist to help that. Coming back to the first question about marriage, that's a very important question you raised. First of all, we should always try to understand the person. What about the marriages? What stopping them to marry? What is the background going on, and help them. Some other issues are coming. Are they going for, we see different things going on in marriage issues. Sometimes the people don't want them to get married. Sometimes they're interested in some people who is not legally allowed in Islam. So we need to know where they're going and where they started. And as a parent, we should be aware of it, how they're raising their kids to go from there. Hopefully I answer your question, but I'm available to answer any questions.
Hello, can I ask you a question?
Sure.
I joined late. I don't know whether my question is related to your topic or not. I'm asking a question about the autism. How often it is genetically transmitted, and how do you advise, suppose a child is there, or an autistic child is in the family, do you advise to marry the first cousins, or it is better to avoid them?
There is, okay, Islam does not prohibit, marriages among the cousins. I have not heard about that. But the other thing is, yeah, it just the genetic wise, does it pass on? Yes, it does. The scientific study has shown that they can pass on. So if somebody, so the problem where it comes is somebody has autistic gene, but it has not been manifested. Like, for instance, I am, and I have autistic genes. So you have tons of genes available, okay? And I have not presented, I have a normal life and going on. Then there's another person who had autistic genes there. So you're adding the disease burden when the next child comes in. So there's a likely chance they may develop. How much chance? I don't know. Depends on what type of autistic disease they have. There are different. There are Asperger's to very highly functioning autistic disorder to non-functioning. They're purely functioning autistic disorder. It depends on how stage the person is, and so usually as a psychiatrist that is not advisable, but I'm not the one, from medical perspective, I'm saying that you're increasing the disease burden and it is transferable to another person, like schizophrenia, major depressive disorder. That's all genes burden pass on to the next one. Does they present? It's in Allah's hand. I cannot say that. A lot of people have a lot of disease, but they don't present. They hold it for all their life. People have what they have found. For example, schizophrenia. People have schizophrenic traits and all those genes loading, but they don't present it because they're holding very well. The normal genes are holding very well to protect it. But when you have a higher burden of genes, which has schizophrenic trends and all those potentials, that normal genes become minor and the schizophrenic genes overloads them. And based on the social and stressful life and all other disease burden plus drug issues, and you can add up more things, and the normal genes become pretty much reduced down to 10%, and abnormal genes goes up higher, and they present that way. So there are people who have schizophrenic genes, but they don't present because they survive. But on the other hand, some people don't. So it varies. So suggestion is yes, there will be transfer to the next kids, and that happens. We have seen it. Whether it's advisable to marry, I'm not here to advise anybody, but you are the better judge because I cannot say about that. Hopefully, I answer your question.
Thank you.
So this is Rehan. Assalamu alaikum, everybody. Can you hear me, Najeeb?
Yeah, walaikum salam, Rehan. Thanks for joining from Houston.
Yeah, I just wanted to second the comment by Brother Yusri regarding taboo in society. So I guess the Arab world is not the only one where this exists. In the Indian subcontinent, this is very prevalent. People will go through inordinate lengths in order to hide the fact that they have people with mental disorders in their family. So it's not, it is an embarrassment, that taboo causes people not to bring out these people even outside the house. So sometimes there is social avoidance in order to, cover up mental disease in many parts of the world, including the Indian subcontinent. But from a practical standpoint, what I wanted to bring out, and I wanted to see what Brother Najeeb has to say about this, we have screening for many things amongst children. So, in certain countries, for example, the UK and many other Scandinavian countries, for example, in Europe, The children are screened. They're screened for, eyesight. They're screened for hearing. You take your child to the dentist. So teachers are trained to identify these traits early because the child spends time in the classroom right from very young age. So these are children of 5 or 6 years old. And even where my kids were in school, the teachers would pick up on these traits, and every child was supposed to go through a psychologist and a screening exam just to see what kind of, I would say, strengths they have at that stage, to see if they're manifesting. You know, children have different abilities which should be identified. So they would pose it to the parents in terms of, look, we're going to screen your child to see, if they're good in language, are they good in maths, are they, but at the same time, they would be screened for mental disorders as well. Do they have certain predilections? Do they have certain traits that can be detected? So this brings a general sort of a recognition that this is a normal thing to do. And this is becoming more common. And I think this is something that should be introduced even amongst our religious teachers. If a child is going to madrasa, if he has a muallim, if there is a, imam, they should be given certain skill set to see if they can recognize those traits. Then perhaps, encourage people to go see a psychologist or a psychiatrist. So these things, there are avenues available within our social setting which could actually be used positively in order to bring out an intervention. So do you have any suggestions, Najeeb, regarding, how this should be taken about and what kind of education should be provided within this environment?
Correct. Rehan, you raised a very important point of view. So the avenues are definitely there. You can talk to anybody and there's a screening method available for majority of disease. The major diseases are all there, but the only problem is the parents are so much reluctant. I met parents who will send their kids to another state to get assessment done just because they don't want people to know about their kids. They have some issues. So the problem is ourselves, that we do so much to avoid that rather than help our kid.
Right.
So screening
So
is always there, but
can I
we
just
try to avoid it.
interject one thing, Najeeb? Sorry, I apologize for jumping in again. So my point was that everybody gets screened so that nobody's singled out as a taboo.
Yes, and that's very important because the kid has strength and weakness. Once we screen their strength, it shows their weakness also. And it's very easy. And that's what I raised last time, that the Muallim or Imam should be aware of it. And the question comes, which I have seen it, there are Imam are very well fluent in Quran and the meaning of the Quran. But when it comes to science, they are catching up. As far as mental health, they are far behind. They are literally far behind. And pretty much to next to nil, they are there. When you discuss with them, they are pretty much clueless at times. And that is a very concerning thing, that why they are so far behind. They should be catch up. The worst scenario which I see is in America, that the kids do psychology and all those things. So they are aware of the linguistic and how you talk and all those things. So when they talk to Imam, in their heart, they're making like this Imam is clueless. And not realizing, Imam does not realize that he's talking, but the kid is saying he's clueless because he's not communicating very well with the kid who knows about psychology, who integrates psychology very well. And he keeps on asking questions, and Imam has no clue about psychology or psychiatry, and he's talking about all the Quran and Hadith without talking about that. And that is a big factor I see. And that's one of the reasons I started this presentation, to make you aware that so much we can help each other from Islam and psychiatry put together. And that will help us because psychiatry teaches a lot of things which will help us to understand Islam, and our Imam and person who's teaching. And in fact, as a parent, I should need to know psychiatry well too. So I can communicate with my kids very well. Unfortunately, we don't do that. And we rely that we are the best person, and we rely on our experience. And unfortunately, the world has changed altogether. Our kids are 10 times smarter than we are. I can say that. So they can fool us in their heart, and they feel like my parents are far behind their time. Why they're saying that? When they say my parents are far behind, because they are not catching up with psychiatry, psychology, and science with the rest of the world. And I feel that's the big issue we have. So we should encourage to get screening when even normally you can get screened. When there's a concern, when there's abnormal behavior coming, screening should be done without, and identifying it should be done by a Muslim or as a parents, we should do that. So 1:1, we have to know about psychiatry and psychology to help our kid. And you raise a very important point about
that. Anybody else has questions?
I don't know whether I should go there or not yet, I'm going to talk about a few things I'm going to ask Brother Najeeb to get his input on. Bismillah ar-Rahman ar-Rahim. Qul a'udhu birabbil falaq min sharri ma khalaq wa min sharri ghasiqin idha waqab wa min sharri nafathati fil 'uqad wa min sharri hasidin idha hasad. I would like him to portray and throw light on the beliefs of a Muslim as far as exorcism is concerned. And is there anything like that? Or the blowing on the knots, what does it mean actually? Does it exist? The Quran is saying something. How do we collaborate this and bring it together, the Quranic injunction with the psychiatry? Thank you.
You raised a very high level question, so let me answer that question. Hopefully I do justice of that. So what happened let me go back so I can answer that question. In medical science and in psychiatry, we start the process when the person is born till the person dies. That's where it is. We don't recognize anything happened before we are born and before after the death. That is nothing. So psychiatry does not acknowledge anything beyond that. So our way of behavior is thinking about what's happening in life right now and go from there. The Islamic concept is start from all together, from the beginning. And so we have the ruh concept, correct? We have the qalb concept and the nafs concept. We have a different concept in psychiatry, which is id, ego, and superego. Now, if you look at id, ego, and superego, that only affects when you're alive and you're dead. That's where the psychiatry is. But the Islamic concept, which ruh, nafs, and qalb, start long time before you're born. Alame qalb, and all the alame arba, the whole concept is all there. So, psychiatry is just over there when we are alive but the Islamic concept start a long time ago. So there is something missing in medical science also, as well as psychiatry, those concepts which start before and after. And it does influence what happens in the middle when we are alive. So what really, that's my thinking, is that Allah give birth to a kid pure, have given the concept of Islam, because we have already acknowledged in front of Allah the existence of Allah and obeying that in Alam Qalb, correct? And then we come here and we are pure by ruh-wise and everything, but we started collecting all the wrong things. So Allah give you chances and give you guidance and all those things to you, but your qalb your nerves controls you so much that your qalb completely get spoiled. It's surrounded, which I think so. Dr. Israr Ahmed went into that also, the relation between id, ego, and superego, and nafs, qalb, and ruh. Also, that your nerves control so much your qalb that the qalb, which supposed to control the nafs, completely gets spoiled and accept the nafs. And when the nafs controls the qalb completely, the nafs drive is pretty much like pleasure seeking for short term. And then it becomes very much involved and there's no connection of the ruh or guidance available to you. So the qalb become the slave of the nafs. And when it becomes that, then Allah just let it go, that nothing can help you. you're done with it, because I have given you the chances, I have given you all the information, I've given you everything, but you're just not taking it, and you're just staying away, and you are just for this life. And then Allah just let you free. Do whatever you want. You can enjoy life, you can enjoy life. You want whatever fun you can have, you can have. This is for your life. So this is the concept of Islam is, but the psychiatry does not acknowledge this concept, what is happened before and what will happen after. So there where the contradiction comes, that psychiatry is limited to what we are living, and that's far it is. But Islam talks more than that. And what we realize it, that the correct concept is. So that is my way of thinking. Does it helps your answer?
Yeah, what I'm trying to get to it is there anything existent in Islam, exorcism, like in Catholics? Do we have people, religious people coming and trying to get the jinn out of you? Or is it just a schizophrenia which is there in the men, and that's what I'm trying to deal with? Is it contradictory, or is it something really possessing? Somebody is possessing me? Allahu Alam, I don't know the answer.
Okay, you raise a very good question. So is the jinn controlling you, or do you have mental health, correct?
Yes.
That causing it. So we know the answer for that question. If you have mental health disorder and you get better, then jinn is not controlling you, because jinn cannot be controlled by a medical disorder. Jinn can come back to you and affect you in different ways. So if you're diagnosed early and treated and got better, of course the jinn is not affecting you, because jinn is very powerful. Jinn can take the throne of Hazrat Bilqis from one end to another end in a blink of a time. So it's a very powerful thing, jinn are. And jinn exist. We acknowledge that jinn exists. And jinn is what? Shayateen. One of the few so jinn could be, in a different way. There are good jinns and bad jinns, correct? So the bad jinns could be shayateen. The good jinns are the one who listen to Quran also, and all those things. So jinn exists in Islam. There is no concept of jinn in the psychiatry. There's a concept of mental health disorder in psychiatry. And if you get treatment, you get better. So that is, and in real sense, we have not seen a documented cases where jinn were involved, which is out of the range of psychiatry to figure out that thing. So the quick answer is, if you get treatment and you get better, and if you get treatment early, better, then chances of jinn are next to nil. Does it answer your question?
Is there exorcism in Islam?
I have to look into to get the right answer, So the jinn controls you, correct? And they do affect you. And there's a concept of magic and all those things there, So that happened to the shayateen, people who are seeking shayateen and people involving into shayateen business. Then Allah let them go and then do whatever you want. You can want to do magic, you want to do this and that. Allah let them go. So that's my belief. But I can look it up on that also.
So as far as the scientist is concerned, the doctor, so my thinking goes against these things, To me, it's only mental health, period. And I cannot see beyond the realm of that, because my thinking is so limited. Allah knows the answer better, but that's what I'm thinking.
Correct. More than 90% is the mental health. But I cannot speak the 10%. There are things beyond the means, the spirits and all those things. That concept is not there, in the psychiatry and or medical issues. So I am not going to comment on that, because Islam talk about it, and on the whole, you will be more than 90% right if those things are happening and you get help and you get better. Even so, the question comes, if you don't get better, is it jinn? Let me put it that way. So the answer to your question is not necessary. If you took 20 or 30 years or 5 years or 10 years later and come for help and you cook the brain, your chances of getting better is less. So don't blame it to jinn. Look at yourself. Because like, for instance, somebody has diabetes and goes into diabetic ketoacidosis, goes into ICU, and then blame that the doctor was not good enough. Well, you just put them into ICU by doing all these things, and now they're blaming the doctor for that. So that's what we are doing. So, you look at yourself that you didn't seek help when it was needed. Patient was crying for help. Same thing with suicidal ideation. Suicidal ideation is help for cry for help. So basically the child is, or anybody is asking for help and you don't help them, then they do things which is out of the normal judgment, and their judgment is poor then, and they do things like that. So we need to help them, these people who are seeking for help and all those. So the insight and judgment is pretty much shut down. It's very poor at the time when they try to attempt suicide attempts. So we need to help them. And regarding the concept of jinn, yes, there's no means basically it's a mental health disorder, and we should try to get help from them, from mental health. And if they don't get better, that does not necessarily mean they are possessed by jinn, because we took so long, because some diseases take longer time to get better or come back to normal. So not necessary. So I will stick to mental health issue rather than blaming as jinn. Does it answer your question?
Yeah, it leaves me in a limbo.
Okay, Brother Asif, if you all and Brother Najeeb will allow me to talk. Of course, Islam believes in jinn, right? We have a surah actually on the jinn, right? And as Brother Najeeb mentioned, there are shayateen of the ins and the jinn, right? And the shayateen could be anybody who's doing evil or who whispers evil things into the hearts and the minds, or affect certain actions of other people in an evil way, right? So we have both shayateen, ins and jinn. We believe that there is jinn, and the jinn is what we cannot see, right? They are creatures that we cannot see. And we know that Prophet Sulaiman had power over them, and he subjugated them, and they did services to him with with what Allah subhanahu wa ta'ala has given to him. And we know also that there are people who use that to separate a man and a wife from one another and things like that. But Allah subhanahu wa ta'ala in the Quran says that they cannot harm anybody without the permission of Allah subhanahu wa ta'ala. So Allah subhanahu wa ta'ala has permitted that to happen. They're not doing something that Allah subhanahu wa ta'ala did not permit it. About somebody being possessed by demons or jinn, as we the Muslims say, and demons by other religions and other beliefs, it's a historic thing. A lot of religions, even non-religions, even paganism, believe in being possessed with certain demons or certain spirits and things like that. Christianity has that, Judaism has that, all pretty much most of the other beliefs as well believe in that. We as Muslims, really, if you look at the scholarly work of, even our older scholars, they talk about mental health issues. They mention so many things. They do not attribute these actually to the jinn as a thing. So we don't know, and we don't strongly believe that the jinn will possess somebody's body and take over their body and can make them act in certain ways that are not normal. Most people talk about mental health issues. They mention sometimes the word al-ahmaq, and things like that, which is a person who is not balanced in their judgment or their own actions. So they mentioned that without mentioning being possessed by that. So it's not a central thing to our belief. Now on the hasad, we believe that, the Prophet ﷺ said, and also in the Quran, the hasad. So there is hasad, which is like the envy or the evil envy, or we call it an evil eye, we believe in that. We don't know exactly the process that it works, but it does happen. Now, Allah subhanahu wa ta'ala taught us, and the Prophet sallallahu alaihi wasallam taught us how to handle that, which is, praying to Allah subhanahu wa ta'ala and asking Allah subhanahu wa ta'ala for refuge and protection from that evil eye or from that hasad. That doesn't make us not seek people. So we cannot just pour it all into one direction, which is like everything that goes in our life, that strong goes in our life is as a matter of, an evil eye or, an effect of the shaitan and things like that. There are mental health issues, and Brother Najeeb mentioned this very well and explained it very well, that need to recognize, and we need to seek help. And the earlier we do it, the better the outcomes are. Wallahu a'lam. And that's my point. I hope I answered your questions.
So can
Brother
I
Reed,
also, sorry.
Go ahead, Rehan.
Yeah, no, I just wanted to interject. I think we should not deal with this in a black and white way. See, it is quite clear that these issues, even Islam in the Quran tells us that these are things that are unseen. When we talk about ghaib, this is knowledge that is not going to be available to us. So why worry about that? God has given us faculty to deal with things with knowledge and logic. Now, even forget mental health disorders, there are many medical problems, organic medical problems, for which we don't know the reason and we don't have the treatment. So I remember I'm an infectious disease physician, and in the beginning of the HIV epidemic, we didn't have any drugs. Our patients all died. So when we did not have anything to offer to these patients, we would tell them, do whatever you think helps you. So, as people of faith, when you're dealing with a disease, you should deal with it like our scholars have said. It's not like a jinn has come over you. You deal with mental disorder as a medical problem. You seek out a solution based on knowledge Allah subhanahu wa ta'ala has given you. And that is based on, a scientific discovery of the knowledge available to human beings at that point in time, the best of the cure. If despite that, you don't have a cure, obviously, there is a spiritual helpline. You can make dua, you can, seek other avenues, but these are purely supportive. As time will go by, you'll have newer cures, but I don't think even from the Islamic point of view. So in that sense, exorcism, even I agree completely, is never a primary modality, or it does not exist within Islam. However, there are, when you're at a dead end and you have nothing that offers help, we used to tell these patients with the HIV, go do, if you want to go to church and pray, if you want to go to a minister, you can do anything that you feel will help you, because I have nothing to offer. And I'm not here to stand in judgment whether A will work or B will work, because I can only talk from a point of evidence. So, a physician, is limited by the knowledge that he has. So I think in essence, I don't recognize it as a black and white thing. I think that we should always work from a stance of the knowledge that we have. Allah has given us faculties. We use those faculties, and we should not worry about things that we do not know completely. So exorcism and all of this in our societies, these are used as primary modalities of intervention. That is, I don't think there is any evidence for that or support for that within Islam or within, the outside or even in other communities. So, that's just my stance.
Yeah.
Rehan, I totally agree with your point of view, because if we take care of mental health, like more than 95% things can resolve easily, which can be avoided, and that should be the way.
If I'm not mistaken, within Islam, I'm sorry, we do have a tradition of mental health disorders. I read a book a long time, and I think that was in Urdu. It was called Nafsiyati Tariqa Ilaj Mein Musalmano Ka Hissa. And in that book, I did not read anything about exorcisms and other things like that. It was, this is a book based on knowledge of old scholars. And it was always about, the background, maybe help seeking, spirituality, praying, things of that nature, but never that, there was a jinn involved, or there was some kind of evil demon or spirit. These things, even in classical Islamic literature, I think are lacking. They do not attribute these situations to evil spirits or jinn or things like that.
Yeah, I haven't seen it in any text that I've read, that there is possession from that. But it's just, I think societies, when they don't have much knowledge, they can attempt to default to that concept that somebody is possessed by jinn. But there isn't anything that I've seen that they say, or scholars talk about something like that, that it is just somebody is possessed by the jinn, and so that now they are controlling them and their bodies and all of that. Now, the existence of jinn I don't think it's disputed in the Islamic literature. Now, how much they can whisper into the mind and all of that, we know the Quran talks about that, right? That the shaitan will whisper in the minds of people, and people will whisper in the minds of other people as well. So we have humans also who whisper in the minds of others. Brother Asif, you wanted to say something?
Yeah, that I agree with you, that whispering is very clear-cut in my mind. Psychologically, it can affect the other person. And once you do that to a person psychologically, you can bog him down, and that guy may be so overwhelmed by this, the hasad comes in, and these things can play a part. Psychologically, you can cripple a person with these things. I am trying to answer everything in the science of light. That's my problem, But when I go to Sirah Muhammad Sallallahu Alaihi Wasallam and I'm looking at it, he's saying that bring me the comb and the hair and from the well and blow on it. These are Muhammad Sallallahu Alaihi Wasallam's words and Quran's words. I'm not questioning it, but sometime in my mind, I try to figure out how do I answer and reconcile in the modern thinking. That's all I'm trying to do,
Yes.
So, brother, go ahead.
Yes. Is there sihr? Yes, there is. Is there sihr? Is there magic or black magic? There's no doubt that the Islamic tradition talks about that, right? So there is sihr. There's no doubt. Now, the possession of somebody, like what we, or certain beliefs that the jinn has entered into the body of a person, and now they are controlling the body of the person. That's something that I haven't seen. Now, the sihr in itself, yes, that there is, and there are proofs that some people did this to the Prophet ﷺ, but that didn't impact his mind and his brain. Also, we know that it exists. We don't know the mechanism how it does do that. And there are a lot of things, as Brother Rehan mentioned, that we don't know the mechanism of, right? One thing that I would add to Brother Rehan, I think feeling good about something makes the outcomes much better. We see it like in our work, you know what I mean? And having good spiritual health also improves that. I think the outcome of treatments gets better if somebody is feeling good about that treatment, even without having a physical means to calculate that. Wallahu a'lam.
Yeah, absolutely. Before we had the germ theory, we didn't know how disease was communicated between each other. So we used to think that there was something jumping from one individual to the other, an evil spirit moving. And this is very common in the medical literature. If you read medical history before Koch's germ theory, people had all kinds of theories of, demons jumping from one body to the other and conveying disease. We didn't know diseases were communicable in that sense. So I think these things will continue to change as human knowledge evolves.
Yeah, I want to add something else, and I will let Brother Najeeb, add something. Brother Muhammad Ibrahim asked a question about marrying and marrying close relatives. We know that there's a saying in Islam, and it's not a hadith. It's marfu' to Umar ibn Khattab radiyallahu anhu. That when he saw certain people and he saw that the kids were weak or looking weak and not healthy, they're called Banu Sa'ib, and he went to them and asked them, why your kids are so weak? Then غربوا النكاح لا تضووا. marry from distant people, not from your own, so that you don't look weak. And we know that Imam Shafi'i mentioned about men and women who do not marry from, outside of their tribes or their own people, that actually that impacts the mental health of their own kids, and he used the word hamaq, which is like poor judgment and poor, actions. So we know in Islam that it's preferred to marry outside your close relatives and to intermarry into different tribes, different nations, and all of that. Wallahu alam.
So isn't this true, Brother Raid, that the Islamic concept of had is to move away from the had? The had is that you can marry your cousin, but that would be a issue of last resort. The had is basically the limit to which you should not cross. So the further you are away from the had, the better. So the more away you are from that had, marrying outside the family is obviously going to be better, even from the Islamic point of view.
Well, exactly. Yeah. I think it was a cultural thing because they did not want to distribute their property, right? So people wanted to marry from their own so that they keep the property in their family and then their strength and their influence and all of that. Which is still
the
happening.
had is
exactly.
Right. It's the limit of permissibility. So the further you are from that limit, the better it is for you. That is what was permissible to the, just the barrier beyond which you should not cross. So the further you are away from it, the better.
Better, yes, exactly.
But the thing is, this is not like Christianity, which look down on marrying a first cousin. Islam doesn't prohibit that.
Actually, there is nothing in Christianity that actually prohibits that. That is just culturally now common within the West. But yes, within the Christian text, there is nothing.
It's looked down upon in this
Correct,
West.
yes, which it should be in Islam also, because in Islam, the had is always the limit, and the further you are away from the had, the better. This is culturally in our part of the world. Marrying cousins was a cultural preference because of property, as Brother Wright said. I think this has been as kind of an issue of marrying close members of the family, but it's got nothing to do with Islam.
But Islam doesn't prohibit that. That's what I'm saying.
Yes, there's no prohibition. So we cannot make that prohibition ourselves, right? Because we cannot change Islam. But on the other hand, we have enough evidence to say that it was encouraged by Umar ibn al-Khattab, for example. It was encouraged to marry from other people, and also Imam Shafi'i mentioned it very clearly that it impacts even the mental health of people, not just the general health of people when they intermarry. In Christianity, actually in Jordan, Christians marry their cousins.
Right. Now,
I don't want to Jordan. They marry.
I don't want to.
They marry in Kentucky also. So.
What is that? Sohrab, you were saying something.
And the Christians have, they don't have any kind of taboo there. They don't do it culturally. In Kentucky, you can marry your cousin if you're Christian.
Yeah, you can. Yeah, I agree. But they just look down upon it, I suppose.
Now, not before. They are actually encouraged. Even the Eleanor Roosevelt was a cousin of Theodore Roosevelt.
She was a fifth cousin, but I don't want to misquote the original Arabic, but isn't Brother Raid in the Quran where it says tilka hududullah, and then the next is that tarry as far away from the had as possible? Isn't this? I forget the actual Arabic, but it is that you move away from the had as much as possible.
Yeah, Rasul Karim Sallallahu Alaihi Wasallam married his first.
That's the hadith of the Prophet Sallallahu Alaihi Wasallam.
But that doesn't relate to the marriage. That is related.
Yeah. Rasul Karim Sallallahu Alaihi Wasallam married his first cousin, and that should be the reason we should not say that it's not good. We don't practice it different. It's not recommended or forced upon, but you cannot say that it's not good.
A good discussion, mashallah. But my question was only because it is because of the lack of knowledge of what in the rural parts of our country, in Pakistan, they bring a guy in that's with jinn chad gaya, and they used to beat the hell out of the guy to get the jinn out, So that is where I got
Right. No, and you're absolutely right. But this existed even in the West. There was a time before
Yes.
the Enlightenment where the same thing happened to a lot of, exorcisms where they would completely clobber somebody, for no good reason.
Yes, yes.
I can
Actually,
add
part
one
of
thing.
medicine for a long time in Europe, when the Muslims were shining in terms of medicine, they associated a lot of diseases with black magic or demons
You're
or
mute.
diseases. When Muslims were treating people with surgeries, with herbs, with whatever, they had hospitals, but it was more about killing the person, or cutting their head and putting a cross on them or something like that, just to get the bad demons out of their bodies.
Yes.
And it caused a lot of deaths in Europe, right? We know that. Now with us again, we don't have that concept in Islam that somebody could be possessed by the jinn. We know that they can impact your mind or the whispers and all of that. But again, Allah subhanahu wa ta'ala mentions to us that, we seek refuge in him and that we do our best. Now, the things that we don't know, we cannot deal with, then Allah subhanahu wa ta'ala handles that. Wallahu alam.
So regarding that, one thing I can say that, do you know, if you live in Dallas-Fort Worth area, you can visit to Terrell State Hospital. They have a museum over there where they actually show you all the treatments given hundreds and 200 years ago. Terrell State Hospital was created around 1750, around that. And at the peak time, they had more than, I think so, 12,000 patients in the state hospital from all over the world. So they have their own graveyards and all those things. And getting the training over there, I used to see the units over there where they used to keep the patients in darkness all night long, all day long. And that's what they used to treat them, with darkness. And they say they are possessed, and that's the treatment. I was shocked to see that, and anybody can go over there and visit that. If you're living in DFW area, Terrell is, I think, so 35 miles from DFW area on the east side. They have the state hospital. You can visit there. They have the ECT machine over there, which was amazing to see. 1920 ECT machine, and before that, how they used to provide treatment over there. So they had that concept of demon concept at that time too, when psychiatry was in infantile stage, let's put it that way. But the world has changed around. Now we can see that 95 or 98% or 99% is a mental health disorder. It's not by the demons, And if there's a demon involved, which Quran says, then it's not in your control. So why we talk about something which is not in your control as the first line of defense? 99% time you will be wrong, because mental health can help your problem. And the shifa is given by Allah. So let's work on 99%, then look at 1% and say, that's the issue. So I'm just saying that 99% of the time you will be 100% right that it's mental health issue. So let's stick to that rather than look into zebras and find out the other things and go from there. That happens that people with, I cannot speak more about that because it's at higher level and everybody has a different point of view. So I'm not going to go into that detail, but that's my viewpoint. Hopefully it answers your question.
I think you answered my question very well. The thing is, when you hear the hoofs, think of the horse, not a zebra. That's very well said. So,
Yeah.
And then we should think about that line, mental health, mental health, mental health, period. That's all it is, Allahu Alam.
If anybody else has any questions or comments.
Brother Yusri, you haven't said anything about how they treated
Brother
Egypt.
Yusri, I think he had to leave us, or his
He's left.
Yes, he's not with us.
Okay.
No. Now, Brother Najeeb, I'm going to ask a question. If if a parent saw that there's certain behavior issues with one of the children or the children, and the other parent doesn't see it, how can they consolidate, or how can they come to somewhere where, you know, seeking treatment is possible, because we think about, you know, one person making the decision, but a lot of times it's true, and it could be one who's denying that there's an issue or doesn't see an issue.
So you raise a question which we see most of the time. There's a conflict in the parent issue, that one person in the parent saying something else, other person does not believe in it. And we, as such, before we comes, if the first thing is the knowledge, like the most common is ADHD, attention deficit disorder. You know, a lot of people completely don't believe in ADHD, and they say this does not exist and go from there. Unless you raise your kid and go through that, they will give you a hard time, you know. So, and then you realize there's something wrong here, because sometimes the parents are not there and they keep on blaming other people and they don't believe in it. So I think so the knowledge is very helpful, even if you don't know it. How about reading about it and listening to the online courses and all those things that guides you all the thing, that these are the one who present this way. And if you see in your kid that thing, that give you a red flag, you know. The people with those issues, you can see the behavior issues happening in home as well as outside the home. So you have to spend more time with your kid and see it and accept that. So that will help them to start the process, because as a parent, sometimes we don't spend time with our kids, and otherwise we also have some taboo or ego issue that why should we label our kid with bipolar disorder when we can get out of it, because it can get better. I just do dua and it will get better. You know, that is our way of thinking is. So what can we do? Allah has given you the treatment available, but we don't seek treatment, but we just seek dua. So, you know, dua is definitely helpful, but if you don't make a move and do dua, how it can go to help you? You know, Allah also asks you, I provide you the way to get better, but you don't want to seek it and ask for help. Allah will help you if you make move. Just sitting on it and asking that things will get better won't help. So, you know, it's Allah's wish what He wants to do in the end. It's dua is the strongest and the best way, but we should not seek dua all the time. Only way, you know, we should seek all the other ways too, rather than. And so that is my way of looking at it, is to have knowledge, have a healthy discussion, you know, accept healthy discussion and seek help, and that will may help change the mind. You know, I will go from there. It's a tough question when one parent says something, another parent says another thing, and the child gets suffer. Usually we see that after 5-10 years, they come back to the psychiatrist with a bigger problem. And unfortunately, that can be resolved out, and, you know, didn't do it. So they get disease burden on the brain, and that is very affecting to them. And how much it can help, we can do the best we can. So it means there are more women out the people says that they came to a psychiatrist could not help, and they committed suicide. Then I would say, where were you when this was happening all the time? You know, you just acknowledge it and then don't throw a blame on the physician. They did the best they can. But so that is very important to have knowledge. Nowadays, knowledge is available online, everywhere it's available. Just you have an open mind to read about it and spend time with your kid. You spend time with your kid, read about it, and have a discussion. We have a very good discussion like this, but you can have discussion with any other sources and learn about it. Nobody's stopping you. You know, the resources are so many available. We stop ourselves because we are so afraid that it will affect our thinking, affects our ego, affects our taboo. So don't talk about it. Don't discuss about it. So we castle ourselves and then blame other people. We should not do that. That's a bad habit. So that's my way of thinking, and hopefully that answers your question.
Yeah, great. Thank you. Thank you, Brother Najeeb. And it makes the treatment difficult, right? Especially if one doesn't even believe in the treatment. You
Correct. I mean, it's both parents has to be on the same page.
Mm-hmm.
Because a child will go in a direction where they want to get out of it. So if one parent doesn't want, the child will go toward that parent. So you have a conflict in providing treatment because they will say, well, this of my parent says no, so I don't need to take medicine. So the other parent can explain everything, but there's a conflict.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam, Ayub. Thank you for coming.
Well, Jazakallah khair for your answer. Sorry. Well, of course, I'm hearing if the recordings are sent. But let me straight jump into it because you brought up an important point, and I want to share an experience from my colleague and get your take about it because we're talking about mental health specifically in children. You just brought up. And of course, this is an anecdote. It's not representative of, anything, but I just wanted to get your take on it. My colleague, I think 3, 4, 5 years back, he had a grandson who was hyper. He said he's hyper, meaning he's very active. And the doctors had prescribed ADHD as a disorder. And one of the concerns was the medication in which they were treating their grandchild, where he said he was he was an active child. As soon as you give the medications the doctors were putting them on, they would really become pretty much inactive, where they had different tendencies of it became worse, basically what he said, where the child would be thinking in a negative way. So generally speaking, is medication the only way to go and treat a child who might be, yes, very active and is not focusing or concentrating on a certain aspect of it? Because I don't know, I had a different feeling saying that because the child was getting worse and they were getting child wanted to harm people or harm themselves. So that kind of takes it into a different level altogether. Even though the treatment was seek, the child was going in the opposite direction. So is medication the only way, or are there other ways that you treat psychological issues in children? Is my question. Thanks.
Oh, good question. So you raised a disease which is very common in pretty much in a lot of places, attention deficit disorder. One good thing about attention deficit disorder is that the medication works right away. So within 3, 4 days or 5 days, you will see the difference in a kid. And if somebody has ADHD and you start on medication like methylphenidate or other medication available, so what happened is that right away you will see within a week are they getting better or not, as compared to major depressive disorder, which takes 6 weeks before you have some effect changes, So that one thing for attention deficit disorder. Other thing regarding attention deficit disorder is that they have behavior treatment available too. It takes longer time to fix the issue. So you can actually approach both ways, medication as well as behavior issues, and go from there onwards. If somebody become more aggressive and all those things, or having suicidal ideation, of course, they need help and figure out what's going on. Is the stimulant making them that far, and needs to readjust the medication, or go to another medication regime to help them, or is the diagnosis different? And that psychiatrist or child psychologist, actually child psychiatrist, can literally help that very easily. So it's a very common problem which can be easily treated. And, we see all those things. Like you take all the medication, you have a side effects and all those things. Like a major depressive disorder, one of the side effects is suicidality. In early stages of taking antidepressant medication, you become suicidal. The reason behind you become suicidal is that you get enough energy to act on it. And sometimes you go into suicidal. That's why it's called black box warning. As a psychiatrist, everybody is aware of it, but we prescribe them because we are aware of that risk-benefit ratios, that this person will not be suicidal based on this medication, based on this history, and based on the facts, and we prescribe them. So you can look at the black box warning even the aspirin. Take aspirin. look at the side effect. More than 70 side effects are there. You just be baffled that how many side effects aspirin has, and we take aspirin or ibuprofen. You can have tons of side effects. So every medication has side effect. That's why we need to go to a physician, talk about it, and find from there onwards to help them. Don't get discouraged that somebody is having this, so I'm not going to do that. Everybody is different. But seeking help and getting help is very important. And majority of people with ADHD get better. As you look into ADHD, 1/3 get better, 1/3 remain the same, and 1/3 usually either getting worse. So we then look at the diagnosis and see how can we help them. Is anything else is missing? People have bipolar ADHD, people have schizophrenia ADHD, people have autistic disorder ADHD. So are we missing something else going on? Just don't blame on ADHD for all the issues. You can have a lot of medical psych issues. Means people have mixed dementia. In mixed dementia, you can have Alzheimer's disease and vascular dementia at the same time. So geriatric psychiatrists can tell you Aricept will help you or make it worse. And in fact, Aricept will make it worse for vascular dementia because it decreases the blood pressure and make it worse. So that is what the geriatric psychiatrists figure out. Are they having mixed dementia, or they have Alzheimer's disease? They have frontotemporal dementia or vascular dementia, or so are we missing something? So just don't blame on one disease that it causes us. And once you know and assess thoroughly, you will find there's other diseases also sitting there. And we need to address those things because it didn't show up at that time initially. And so then they work on it. And then you go from there onwards that what medication will help them. If you have ADHD with bipolar, of course, stimulant will make the manic worse. So what medication to give? These are things to consider. So that's my viewpoint, that don't take it literally. You have to spend time and effort to get help, and it will help you. Have I answered your question?
Jazakallah for your insights. I wanted to actually what I wanted to hear was we are talking about allopathic medicine, and we know their side effects. I get that, but are the alternative medicines that are effective but in time? For example, homeopathy is a medicine. So what I'm trying to understand is, there are medicines that are natural in nature that we even take, where we can, but it's not an instantaneous switch that you can flip to have your body healed or your mind healed. So I wanted to hear about those alternative medicines, in just not allopathic medicines, if they are in it. Of course, you're trained in the allopathic way, but are there other ways to treat?
Okay, a good question asked. So we also train to be aware of it. Let me give you an example. Saint-Bot medicine. That's a common medicine given for depression, Saint-Bot. Unfortunately, what we have seen that these people have bleeding disorder and they die from other issues given for depression. Very commonly given for homeopathy and other medicine, alternative medicine. So being a psychiatrist or a medical doctor, you should be aware what alternative medicine a person is taking, or what medicine on the counter are you taking. That is very important because sometimes ibuprofen can make it worse, or other medication on the shelf can make it worse. So we are trained that way to look into that. We don't have much data on alternative medicine, but that's the best we can do. That if we see a red flag, we tell the patient.
Jazakallah khair.
Right. Do we want to continue this session next week with more questions, more difficult questions for Brother?
Sure, I will be happy to do so.
Okay, all right, inshallah, because I think there are more questions, inshallah.
We have a hand-raised iPad. I don't know who it is. Brother,
it's actually not a brother, it's a sister. It's
Yes.
Khadija, and assalamu alaikum, everybody.
Wa alaikum salam.
I just wanted to comment about mental health when it comes to African descended from Africa. In Africa, the awareness of mental health has been upfront. However, people associate it with superstitious reasoning and witchcraft mostly. The issue, I believe, is normalizing mental health and removing the stigma of mental health, educate the people as much as possible about the mental health. I also wanted to find out from you, what's your take when it comes to the stance of gender divide when it comes to accepting help for mental health disorders? Is there anything you've noticed when it comes to genders accepting mental health disorder?
Can you repeat the question? Something came up. I had to leave in the middle, so I apologize for that.
It's okay. I said in Africa, the awareness of mental health has been upfront, I believe. However, the people associate it with superstitious reasoning and witchcraft mostly. The issue, I believe, is normalizing mental health and removing the stigma of mental health, educate the people as much as possible of mental health. Also, what is your take when it comes to the stance of gender divide when it comes to accepting mental health disorder?
Oh, okay. So gender divide among mental health. So my thinking is the more we are educated, the more we can do better. So there are places in Africa where they are more knowledgeable and they seek help. But then is the help is available also. There are countries where help was available previously, but not more available nowadays. So that is a big issue. Then we go to people who do all those things, witchcraft and all those things because of superstition and all those things that make it worse. That happens in the third world countries also the same thing, which I hear in Pakistan a lot. So the more knowledgeable you are, the better it is. As far as gender is concerned, the same story, I feel like the more knowledgeable you are, better you can cope with that issue rather than, especially the parents. Parents have to be knowledgeable how to deal with that. And just don't bring Islam all the time and going to somebody who is religious and don't know much about mental health. And sometimes I have not seen good results coming out from that. Dua is always there. If you have problem, ask Allah with yourself dua rather than asking a third person for doing dua and all those things. You should not do that. That's my belief, and I believe in that. So knowledge is very helpful. Does it answer your question?
Yes, to some degree, yes. When it comes to the gender, do you find it that men are more susceptible, pretty much they are resistant in accepting help for mental health than women? Or what's your take on that?
It's the ego issue comes in. The men have their own ego and their way of thinking that I look smaller if I have mental health problem. If I have depression, then what people will say. So they are resistant to that. And same thing goes with their kids. So if their kids have some problem, then it falls on men, then they are resistant. It's more culture, it's more how personality is, and it happens in so many places. Even in America, also the same story. And men does not want to talk about it. They don't want to deal with it, and they try to avoid as much as possible. So unfortunately, it happens in this part of the world too, the same issue. So knowledge is the most important thing we can do to help ourselves and our community very well. Does it answer your question?
Yes, Jazakallah khair.
Brother, brother, right?
Yeah, brother Ayub, if I...
No, once you finish,
Yes, it follows the same trend of seeking treatment in general, right? Men are less likely to go to doctors than women. I believe also 80% of medical appointments are done by women, not necessarily for women, but they do the appointments for the spouse, the kids, and everybody. So pretty much, I think women save a lot of men from dying. Of course, a lot.
Brother Reed, I have to go. Can we join next week and you can continue? Is that okay with everyone?
Inshallah, Brother Najeeb. We understand. Actually, you were supposed to leave by 9, but you...
Yeah. No, that's fine. But thanks for everyone to join in, and we'll see you next week. Thanks, I appreciate it.
Brother Ayub, unless it was a question to Brother.
No, it was not a question. Actually, Sister Khadija brought up a very interesting topic, but we can talk about it next week in the context of Africa. And it's important for us to understand the contextual nature of the country itself, because as she said, the black magic piece that is prevalent in all parts of the world, but more so in some of the other parts of the world, is derived from a lot of social constructs within society. That's number one. And that added to that is the gender issue rightfully brought up, that sidelines either women to an extent that the construct, their agency to express themselves is taken away. But again, I know we are trying to wrap up. I'm not going to, probably I wanted to reflect on that. That's why because it was such an important question for us to understand it from, it's just not a critique, but we have to self-evaluate where we are as Muslims, including men, and how that agency is not given to women for their expressions as well, and how that causes what the cause and effective is in the society. But that's for a later point. But I just wanted to say that. Jazakallah khair.
I just wanted to add one thing before I go off. I have just posted an article from Annals of General Psychiatry on the line Isha Group, Islam, Mental Health and the Law and General Overview. It gives you a general overview about Muslim belief in mental health and how history and all that. So just read it before you come next week, inshallah.
Inshallah, you placed it on the
Isha Group.
Isha Group, both places, right? On WhatsApp as well.
Yeah, and WhatsApp Isha Group.
Okay, inshallah. And I will share it with the Labaki group, inshallah.
Inshallah. I haven't read it completely. I'm reading it right now, okay? So this is a good article, just a historical view and our concept and all that.
Inshallah. Jazakallah khairan. That's great. If anybody else wants to make a comment, that'll be great. If not, we can adjourn the meeting and make dua.
We can make dua, and I just posted that article in our chat here. So inshallah.
Yes. So if anybody wants to review that article.
Brother, I have a question and not a comment. But since this discussion was about jinns and possessing bodies, I heard this that there is a jinn born with every human, that is Kareen called. What is that concept?
Say that
the
again.
jinn is called Kareen, that every human
Kareen.
has a replica of himself that is born with him, and he's probably a jinn.
Yes. Yes, I need to research more on it, and inshallah I will do. But the Qareen, my understanding is that the Qareen is a jinn that sees you and can whisper to you and can tell you certain things, but again, it does not affect your actions. So the Qareen could be a jinn, which is like a creature that we don't see, that they can see us and they can, impact our thinking, but not really our actions. Really, our actions, we are all responsible for what we do. So that's basically the Qareen. That's my understanding of the Qareen, but I will research it more to have.
Yeah,
better.
please. I need to understand that, because I heard that those people who do sahar, or they actually take control of that, your jinn companion, to get information about you, or because he knows he's actually you, but in a different form.
Yes, but again, there's nothing that like, because if you look at the iman and kufr and all of that, right? You are responsible for that, unless you are a person who does not, Allah subhanahu wa ta'ala did not give you the faculties of making the right decision. if Allah subhanahu wa ta'ala gave you the faculties of making the right decision, then you are responsible and nothing else impacts you. So your own decisions. Does that make sense? So we cannot say like Abu Jahl, his qareen was impacted and he was the one who was making.
No, not like that.
For
Not like
example,
that. But
I know that.
there
I
is
know
a
that.
jinn that is, I think, has an Islamic concept that everyone has a jinn with him. So what is that?
Yes, inshallah, we'll research it so that we can say things, you know what I mean, from, you know, good resources, inshallah. But it's a good point to understand something that's good. So Harab, you wanted to say something?
No, let's make dua.
What is that?
Let's make dua.
Dua, inshallah. Allahumma hadina fi man hadayt.
Ameen.
وعافنا في من عافيت
Ameen.
وتولنا في من توليت
Ameen.
وبارك لنا فيما أعطيت
Ameen.
إن شر ما قضيت
Ameen.
إنك تقضي ولا يقضى عليك
Ameen.
إنه لا يذل من واليت
Ameen.
ولا يعز من عاديت
Ameen.
تباركت ربنا وتعاليت ربنا آت نفوسنا تقواها وزكها أنت خير من زكاها أنت وليها ومولاها
Ameen.
صلى الله وسلم وبارك على سيدنا محمد وعلى آله وصحبه وسلم. سبحانك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
Brother Ayub, Brother Ayub,
Yes.
you have to start coming back for the tafsir, brother.
Inshallah.
I miss you.
I miss you all
Even
too.
we have biryani today. So if
I miss
not
you all
for
too.
us, come for food.
No, it would be only for all of you. Food is a non-factor whatsoever. But I miss you all too. I hope to join you all next week, inshallah.
Inshallah. Jazakumullah khairan. Everybody enjoy your.
And Azloni, you should come too. Once you feel
I
better.
did not come today because I was not feeling well all last week.
I
So
know.
I did not want any of you to feel not well because I came. That's all. But I attended the online session. I did not say.
Yeah, you didn't come and used to just taking all the time. So you have to come.
I missed the biryani. So Brother Jimmy, I need some biryani saved for me next week. Okay.
And next week, history is presenting. Don't forget.
Then we need to give him the hard time. I agree with you, Brother Saurabh. Brother Saurabh is being strategic here. Okay, got it.
Jazakumullah khairan.
Assalamu alaikum wa rahmatullahi wa
Thank you all for attending. Inshallah, we'll see you next week. Inshallah.
Inshallah.
Wa rahmatullahi wa barakatuh.